All right. So, hi, everybody. My name is Dr. Kynetta McFarlane. I'm a clinical psychologist, the owner and operator of Transformative Health. I'm one of the experts on the ECHO team, and I am the Equity and Inclusion Coordinator for the Center of Innovative Practices. So, today I'm going to be talking to you about ADHD and differential diagnoses. And I love that I'm doing this didactic this morning because I'm an individual with ADHD and have a daughter who has ADHD. So we'll talk about why that's a little bit important later. All right. So this is a good thing for us to talk about because ADHD is one of the most common diagnoses in children and teens. When I looked at the research for like the last 10 years, ADHD falls in like one of the top five diagnoses that children are diagnosed with. And one of the things that we know is that in right now, around 9.4 children in the United States aged 2 to 17 right now have ever had an ADHD diagnosis. And that represents about 5.4 million children. However, community samples show a somewhat higher rate, ranging anywhere from like 8.7 to 15.5%. So, among children with a current ADHD diagnosis, almost two-thirds were taking medication. Approximately half had received some level of mental health treatment, and then a quarter had received like neither types of treatment. The median age of diagnosis for ADHD is 7, and approximately a third of the children were diagnosed before the age of 6. And this makes sense because the last time I did a didactic, I talked about neurodevelopmental disorders, and ADHD is one of the neurodevelopmental disorders. And a neurodevelopmental disorder just means that the disorder is something that occurs during the developmental period and that it affects a child's developmental function. And so, in terms of ADHD, it is definitely a disorder where we are looking for those signs in childhood. In terms of ADHD, children raised as boys are more than twice as likely as girls to receive a diagnosis of ADHD. And a lot of this has to do with boys are more likely to display hyperactive behaviors. And those behaviors are really easily observable and potentially disruptive. So those behaviors will often get a child in terms of seeking a diagnosis. And one of the things that we know about those hyperactivity symptoms is that the hyperactivity and impulsive behaviors that we see with ADHD tend to decline over time, whereas those inattentive symptoms tend to stay and persist. So girls are more likely to have the inattentive symptoms, and because you don't really like see those symptoms, girls are more likely to get diagnosed later. And so all children with ADHD are the majority of children with ADHD have another diagnosis. Learning and language problems are very common. In terms of in girls are seen to have like more difficulties in terms of with like anxiety and depression. And because often it's untreated in girls, they're at a higher risk for low self-esteem, underachievement, and also are more likely to get pregnant and start smoking while in middle school. So, in terms of what we know from science, science has shown that there are differences in the brain size of children with ADHD. Research has indicated slightly smaller brains. However, the smaller brain size in terms of volume doesn't seem to have any linkage to like any deficits in terms of intellectual functioning or problem solving, overall problem solving functioning. Other areas that we've seen differences in terms of networks, the neurotransmitters. Individuals with ADHD have lower levels of like dopamine and norepinephrine. Dopamine is involved in our pleasure and rewards, versus dopamine is related to our focus and processing. And then also different like parts of the brain in terms of like the limbic system that processes emotion, memory, and rewards. But the major area of difference that we see in individuals with with ADHD is alterations in the development of their prefrontal cortex. And these alterations are believed to be seen through birth. And one of the things that we talk about is that ADHD is very much something that you see that runs in families. And so when I'm talking to families, I talk about like how we like, you can tell like that you all are all related because like you're really tall or you all have really big feet. Well, we can't see how like, on the inside, like how our brains are also like shaped the same. So it's really like not unsurprising in terms of like the way that the front of your brain develops that that there may be other people in your family that also the front of their brain develops that way. So in terms of the skills that the front of the brain is in, the prefrontal cortex is in charge of are called executive functioning skills. And those skills include our ability to inhibit ourselves, so to stop ourselves. So I am very talkative, and it's often hard for me to inhibit because I have so many wonderful things to say that I know everybody wants to hear. You have difficulty in terms of shifting from like one thing to another. So I'll start doing something, but then it's hard for me to shift away onto like the next task. So one of the things that I'm doing right now is I keep looking at my watch because the thing is difficult for me. Emotional control is also something that is one of the executive functioning skills. So it's not unsurprising to see a kid with ADHD may also have difficulties in terms of controlling their anger or be able to like control their ability to like not get at that thing that they really want. Initiating, being able to start at things. As a person with like ADHD, one of the things that I've started doing with friends is co-working because it's hard for me to just start initiating work all by myself within my like own house. And so if I have like a co-work session with a friend, I initiate and I start. So initiating all by yourself is something that's very difficult for people with ADHD. Working memory. Working memory is like the short-term memory that you need to use right now. So I have to remind myself to check my watch because my working memory is more difficult for me to access. So it's really easy for me to like stop and like remember something as I'm doing something else like in time. Another area is planning and organizing. So being able to plan out things. So that's why it's not unsurprising to see the forgetfulness that goes along with ADHD because it's harder for you to plan and organize and then monitoring your behavior. So telling myself to check my watch is for me intentionally telling myself to monitor my behavior because it's very easy for me to just kind of keep going and not shift and not recognize that, oh, you're going too long or, oh, you're talking too loud. So in terms of ADHD, there are three different types. The first type is inattentive, and those are the kids that I describe as more of like this space cadets, forgetful kids. Those are the kids that often do not get diagnosed until later because they're not a problem for anybody. Versus the hyperactive kids, those kids are diagnosed at 4 and 5. The hyperactive impulsive type kids have a lot of difficulty in terms of self-settling. And honestly, those kids generally are identified pediatrically because their level of like, you can see their difference when you like observe them in like a preschool setting. Their ability to really be able to self-settle their body is very different than their peers. Now, most individuals have combined type, where you have symptoms of both the inattentive and the hyperactive symptoms. So the inattentive symptoms, what does this look like in real life? This is an individual that makes careless mistakes. It's hard for them to pay attention or to keep their attention on task. It feels like they're not listening to you even when you're talking like directly to them, or you feel like you have to kind of keep getting their attention. They're very unorganized. So these are kids where like the homework never makes it from like school to home or like home to school or even like remembering what was done for homework. So they never have any homework because they always forget about it. They avoid work that takes a lot of time. So they may start at something and just kind of like give up easily because staying at a task is hard. They lose things often they're very easily distracted by outside things, and they have a tendency to be forgetful. The hyperactive and impulsive symptoms. So that's a lot of fidgeting and squirming around in your seat. That's an individual that will often like leave their seat. We would know when my daughter, when she was younger, when she needed to get her meds changed, was because she was crawling around in the back of the classroom. And when the teacher would see her, she would say, can you go back to your seat? And she'd compliantly go back to her seat. And then about 10 minutes later, she'd be rolling around in the back of the classroom. So leaving your seat often, running or climbing and getting into things too much. These are the kids that parents describe to me like they walk into the room and they jump into their arms. Difficulty like playing quietly, always moving, always on the go, always needs something to go on, and very talkative. In terms of the impulsivity, these are the kids that in classroom just blurt out answers. And if you're a smart kid, nobody says anything to you about it, and that behavior may be like let go of. These children also have difficulty in terms of waiting their turn, and then they'll often like interrupt others like during conversations. So one of the things that often comes up like in our echoes that'll come up is like we'll see a kid that has like the diagnosis of ADHD, and there'll be trauma symptoms there, but they don't have a trauma diagnosis. And one of the things that will often come to me as like my job as a diagnostic assessor specializing in trauma is trying to like pull apart like what are the symptoms of trauma versus like one of the symptoms of ADHD. A child who has gone through trauma has a lot of symptoms that look like ADHD. In terms of when you're really anxious, it's hard to like sit down and settle your body. It's hard for you to like focus. If you have a lot of disorganization and traumatic things happening to you on a consistent basis, that will like interfere with your ability to remember important tasks, that will interfere with your ability to be able to be organized. You may be more talkative because like you're worried and it's hard for you to settle down your body. So there are a lot of behaviors that we see like associated with trauma that look a lot like ADHD. However, kids with ADHD often don't have like high levels of like fear and uncertainty. They often are not just like edgy and on guard. They are not like avoiding things. While kids with ADHD often have difficulty in terms of like anger management, it often will like look the same in terms of like it's usually not the crankiness kind of type of anger. It's more of the anger of like I don't know how to stop myself, or I've gotten activated and I don't know how to bring myself down, but not really like the crankiness. You don't usually see the guilt or shame, the feelings of disassociating or not being inside of your body, feeling like you're always on edge or alert, or the really reckless and like self-destructive behaviors. So as you see in terms of that overlap, while there's a lot of symptoms of ADHD that looks like trauma, there are many trauma symptoms that would not be typical in terms of looking for a child in terms of diagnosing for ADHD. So as an assessor, when I have that child in front of me, an important question is, when did the trauma happen versus when did the symptoms start? And so this is why kids for ADHD need assessments, because ADHD can mask and look like other things. So a complete evaluation typically will include a parent and child interview, reviewing a family's medical history, especially if other family members have ADHD or the symptoms of ADHD. It's not unsurprising for a lot of research is talking about the number of adult women, and I'm like one of those women who got diagnosed with ADHD partially based off their child being diagnosed with ADHD, because when they start asking you those questions, you can go back and look in your childhood. And I was somebody who was always hyper, but I did really well in school. So all of my hyper behavior, they said, oh, she's smart. Oh, she's smart. And they just gave me more stuff to do. And so like all of my behaviors, just kind of like because I had more socially acceptable like hyperactive behaviors, I didn't get in trouble because I was like my daughter. If I was rolling around and doing something, if you asked me to stop, I'd do it. So, yes. So the next thing that we're looking at is parent and teacher, child and behavior, like rating scales. The child also filling out rating scales about like their experience in the world. Observing the child's behavior at different tasks and seeing like how do they do when in times where they need to like wait. Psychological tests. So doing an IQ test in terms of problem solving. I've worked with children where it appears like it's ADHD, but it's not. It's a working memory or it's a processing speed disorder. And when we can address those disorders, all the other symptoms kind of like drop away and you can see that it really isn't ADHD. So doing testing of that. Another test that's also important is language skills testing. A lot of children who have difficulty in terms of like being able to understand language, how do you look in a classroom? You're very inattentive, you're not paying attention. It's hard for you to follow along. So also like those standard testing to make sure that a child is functioning in terms of like at that developmental level where they should be. And then medical screenings, such as vision, hearing, and speech screenings to make sure that that isn't what is happening. Before I've had a child that is in front of me that we suspected that it was ADHD, but it was really a vision problem. And this is a child that is having difficulty interacting with their environment. And because they've had the problem so long, they didn't know that they had a vision problem. They didn't realize the things that they weren't able to see until going through a vision screening. And a number of my clients, in terms of working in community health, vision is not necessarily a part of your health plan. And so they may not get like a vision screening if they're going through just getting shots to be able to enter into like the school system. So being able to have like those base level screenings can also help to rule out that information. And so that is the end of the presentation. If you would like to get more information about being able to tell the difference between ADHD and trauma, there's an awesome, that graphic came from the National Child Traumatic Stress Network. They have a handout, is it ADHD or child traumatic stress applied for clinicians, that I would recommend that you would check out if that is the population that you work with. Thank you so much for your time.